For those of you who I haven't met yet, my name is Aiden Jones. I'm a help desk specialist here at Fulton County Medical Center, and today I'll be walking you through how to set up and use the patient portal. So first, I'll give you a quick little overview of what we'll cover in this PowerPoint. We're going to go over two different patient portals, the Meditech and Medent. For each one, I'll show you how to find the portal, how to set up the portal, and then how to create your login, and then what to do if something along that process doesn't work, and then the differences between the two setup processes. Then we'll look at what the dashboard looks like once you're signed in. So you may be asking, which portal should you use? You may want access to one or both portals depending on where you were seen and what information you're looking for. Meditech is where you'll find things like appointments, results, reports, medication, labs, and imaging. And then Medent is used for more office and specialist visits like family practice, cardiology, surgical services, orthopedics, urology, and then the other offices listed down here. So if you log into one of the portals and don't see what you're looking for, it's probably in the other portal. Just real quick before we get into setting up the portals, I want to quickly go over the patient portal user agreement. This is just a brief overview of what you're agreeing to, and you should still read through it before accepting it yourself. The biggest thing to remember is that the portal is not for emergencies. So if you have an emergency, make sure you call 911 or go to the nearest emergency room. This portal is also not meant to diagnose or treat anything, and it may not show your complete medical record. It is mainly there to help you view certain health informations. And then since this is private health information you'll be accessing, make sure you keep your username and password private. Avoid using public computers, and then make sure you close out of portals when you're finished. So by logging in, you are agreeing to the portal's terms. If you have any privacy questions, feel free to reach out to the privacy officer number, and then that number is listed on the slides down here. So now we'll start with Meditech. We'll start with where to find the portal and walk through the setup process as I mentioned in the overview. So the easiest way to find the portal is to go directly to fcmcpa.org/patient portal. That page has the links for both Meditech and Medent, so it's honestly the best place to start for either portals. You can also search for Fulton County Medical Center patient portal online, but I do recommend using the website directly so you know you're going to the right place. So once you're on the Meditech login page, you'll either log in if you already have an account or click self-enrollment if you need to set up one. For self-enrollment, you'll enter your first name, last name, date of birth, and email address. Make sure your name is entered exactly the way it appears in your medical record, because if the information doesn't match, the enrollment may not go through. Once everything is filled in, just hit submit. If your enrollment goes through, this is where you'll create your Meditech username and password. The example shown here is just a reference for what it may look like, but you'll choose your own login information. Please keep in mind that there are username and password requirements. They're listed above each entry, but I also included them here in the slides for visibility. You also choose a security question and answer, which helps if you ever get locked out and forget your password. And then once your account is created, make sure you write down your login information somewhere safe. I suggest a password manager if you have one. If you don't, you should get one. Once you get signed in, this is what the Meditech dashboard will look like. Most of what you need will be in that left side menu. From there, you look for things like appointments, results and reports, medication, past visits, documents, and billing. So after your account is set up, this is pretty much the only area you'll move around the portal in. If you try to enroll and see this error screen, you can call us at the help desk number listed here or send us an email. If you email us, include your first name, last name, and then date of birth, and then let us know that you need help with the Meditech portal. Once we have that information, someone from our team can help you finish the enrollment process. If you're contacting us on behalf of another patient, there are some consent requirements we have to follow. I'll cover that more in detail on slide 19. After contacting the help desk, you may receive an email from FCMC Patient Portal. That email will come from no reply@fcmc.org. and it will include a link to continue to your enrollment. Click the link in the email to keep going. If you do not see the email, make sure you check your spam or your junk folders. After you click the link in the email, it'll bring you to this sign-in screen. Once on this screen, your temporary username and password should already be filled in for you. So all you'll need to do is click the blue sign-in button. After you sign in, you should be brought to the same page, username and password setup screen we covered earlier. Now we'll move on to Medent. The Medent setup process is a little different because it starts with an activation code. To set up Medent, you'll need the activation code I just mentioned before. You may receive this code during your visit, or it may be sent to you by email after your appointment. Make sure you keep that activation code handy because you'll need it during setup. Also, keep in mind that the code is case sensitive, so it has to be entered exactly as it was given to you. On this screen, you'll create your Medent login name and password, then you'll enter your activation code. The example shown here is just a reference for what it may look like, but you'll create your own login and use your own activation code. So please keep in mind the password and username requirements. They're also listed on the screen for visibility. The activation code is case sensitive, so make sure you enter it exactly as given to you. And then once your account is created, make sure you write your login down somewhere safe. And then again, I suggest using a password manager if you have one. And then if you don't, get one. Once you're signed in, this is what the Medent dashboard will look like. Just like Meditech, most of what you'll need will be in the menu on the left side of the screen. From here, you can look for things like messages, appointments, medication, allergies, documents, and chart information. The layout is a little different from Medent, or Meditech, but the idea is the same. This is the main area you'll use to move around the portal. And then just a quick disclaimer. If you're helping someone else set up their portal, there are a couple things we have to check first. Since the portal has private health information, we have to make sure the patient gives permission before we help with access. The easiest way is for the patient to be present and then give consent whenever you call. If they are not present, we may need something like power of attorney. You'll have to have power of attorney over them. For children under 14, we may be able to help a parent or guardian if the information matches what they have on file, such as the same last name. This is just to make sure we are protecting the patient's information and then giving access to the right person. These are just some tips and common issues that we already touched on throughout the presentation. I included them here for your convenience, so feel free to read through them on your own time and then refer back to them if you run into any issues. If you run into any more issues after today, this is where you can reach us. You can call the help desk at the number listed here or email us. When you reach out, please include which portal you need help with so that we can point you in the right direction. That's the end. I hope this helped make the patient portal setup process just a little bit easier to understand. So I want to say thank you for taking the time to watch. Bye.